Imagine stepping out on your lunch break, dropping upwards of 1,500 pounds, having a doctor draw a vial of your blood, spin it in a centrifuge, and then inject it directly into your most sensitive erogenous zones.
Yeah, I mean, it sounds intense.
It really does. And the promise at the end of this rather intense 45 minutes, a guaranteed biological shortcut to a better, faster, and more intense orgasm.
Right. It honestly sounds like science fiction tailored specifically for cosmetic clinics. But, this is a very real, heavily marketed procedure operating in a space that traditional medicine has historically just ignored.
Exactly. We are talking about female sexual wellness today. It's a landscape that is highly sought after, but rarely discussed openly and filled with patients who are just desperate for solutions to things like, thinning tissue, painful sex, or even simply a loss of sensation.
Yeah, it's a huge issue for so many.
So today we're zooming in on a very specific procedure that's trying to fill that vacuum, which is the so-called O-shot. We're asking you the fundamental question: can this injection actually make orgasms easier to achieve?
And to figure that out, we are looking at this wild intersection of human biology, psychology, and some incredibly aggressive marketing.
We really wanted to cut through the noise for you today, so we pulled together a massive stack of sources. I mean, we're looking at a mountain of marketing materials from cosmetic gynecology clinics across the US and the UK.
Plus the clinical data, right?
Right, yeah. We brought in robust, independent clinical data overviews from IE, that's the National Institute for Health and Care Excellence. And to provide a critical counterbalance, we are examining a peer-reviewed medical journal article from the PMC that takes a very, very hard look at the cosmetic gynecology industry as a whole.
Because the contrast in these sources is just stark. I mean, the glossy clinic brochures are promising absolute miracles for your sex life, while the clinical data is waving some massive red flags about, well, methodology and long-term safety.
Yeah, completely. So our mission for this deep dive is to peel back that glossy clinic marketing and find out what the O-shot actually is on a cellular level. We want to know what the science really says about its effectiveness and ultimately determine if it's a biological breakthrough for female orgasms or just an overpriced placebo. Okay, let's unpack this.
Yeah, let's do it. So to evaluate if this shot actually makes orgasms easier, we first have to understand the substance going into the syringe. The clinics love to refer to it as liquid gold.
Liquid gold, wow.
Right. But it's not a pharmaceutical drug, and it's definitely not a synthetic hormone. The O-shot, which stands for orgasm shot, by the way, is fundamentally a platelet-rich plasma therapy, or PRP.
PRP, okay, so they are using your own body's material.
Exactly. The procedure starts with a really small blood draw from your arm, usually just about 10 milliliters.
So just like a standard blood test at the doctor's office?
Yeah, basically. Then that vial goes straight into a dual spin centrifuge.
And what does that do exactly?
Well, the centrifuge is key here. It spins the blood at an incredibly high speed to separate the heavy red blood cells from the lighter plasma.
Okay.
See, blood is normally just a transport system, right?
Yeah.
Moving oxygen and nutrients around. But by spinning it down, you isolate and concentrate the platelets within that plasma.
Oh, I see.
And then this concentrated serum is drawn up and injected directly into specific targets. So the clitoris, the anterior vaginal wall, often called the G-spot, and the labia.
Wait, we need to pause on the platelets for a second. Because, I mean, most people know platelets as the things that rush to a paper cut to clot the blood and form a scab.
Right, yeah.
But the clinics are claiming these platelets are doing something far more complex in the genital tissue, aren't they?
They absolutely are. If we connect this to the bigger picture, platelets are essentially your body's emergency medics. Clotting is really only step one. Step two involves releasing a massive payload of powerhouse proteins and growth factors. We're talking about things like VEGF, PDGF, and IGF.
Okay, let's break those acronyms down so we aren't just swimming in medical alphabet soup.
Fair enough. Think of VEGF. That's vascular endothelial growth factor.
Vascular endothelial, okay.
Yeah. The entire job of this specific protein is to build new blood vessels from scratch.
Oh, wow.
Then you have PDGF, which is platelet-derived growth factor. Its job is to trigger cellular replication and division. So these growth factors essentially act as chemical messengers.
Sending signals to the body.
Exactly. They flood the local tissue, wake up dormant stem cells, and instruct the body to aggressively grow healthier, newer tissue in that specific area.
So it's like a targeted software update for the body's hardware.
That's a great way to put it, actually.
You're taking the body's natural healing resources, which are just sort of circulating in your arm, waiting for an injury, extracting them and deploying them at exactly where they are needed most to optimize the sexual system.
That is the exact biological theory the clinics are selling. And from a logistical standpoint, places like Elite Aesthetics and Dr. SW clinics have streamlined this into a very quick consumer experience. The entire treatment takes about 30 to 45 minutes door to door.
And regarding the pain, because let's be real, needles in the clitoris or the vaginal wall sounds objectively terrifying to most people.
Oh, absolutely terrifying. But the clinics utilize a strong topical numbing cream prior to the injections. According to their literature, patients consistently rate the pain around a 2 out of 10.
Really? Just a 2?
Yeah, they describe it mostly as a feeling of mild pressure rather than a sharp sting. And they boast zero downtime, claiming patients can resume intimacy the very same day.
Though, as I mentioned earlier, this comes with a pretty significant price tag, right? Often ranging from £1,150 to £1,500 in the UK.
Yeah, it is definitely an investment.
So we have this biological fertilizer derived from your own blood injected into erogenous zones. Now we have to look at how these clinics claim this specific mechanism translates to better, easier orgasms. Because, reading through these brochures, the promises are astonishing. They're claiming greater arousal from clitoral stimulation, stronger orgasms, more frequent orgasms, an increased ability to achieve vaginal orgasms, and enhanced natural lubrication. That is a lot.
It is a lot. To understand how they justify those claims, we really have to connect the local injection to the broader physiological processes triggered by those growth factors. The clinics lean heavily on three main biological mechanisms. First up is neurogenesis.
Which is the creation of new nerve endings, right?
Exactly. By supposedly sprouting new, highly sensitive nerve endings in the clitoris and the vaginal wall, the threshold for arousal drops.
Okay, that makes sense.
So the tissue becomes hyperresponsive, which theoretically makes orgasms faster and easier to achieve. The second mechanism is angiogenesis.
Angiogenesis, which ties back to that VEGF protein you mentioned earlier, building new blood vessels.
You got it. Better blood flow is the absolute foundation of sexual arousal. By creating new microblood vessels, you improve the tissue's ability to engorge during arousal, which directly increases natural lubrication and heightens physical sensation.
Right. And what's the third mechanism?
Collagen remodeling. The injected growth factors stimulate local cells called fibroblasts.
Fibroblasts.
Yeah, to produce more collagen and elastin. This physically thickens and hydrates the vaginal walls. This specific benefit is heavily marketed to women going through menopause who suffer from dyspareunia.
That's the medical term for painful sex, right?
Correct. Painful sex caused by tissue thinning and dryness. The idea is that thicker, more elastic tissue means less friction, less pain, and consequently more pleasure.
But the marketing doesn't just stop at sexual pleasure. Going through these sources, the clinics are also pushing the O-shot as a treatment for actual medical conditions.
Yeah, they are.
I saw they say it treats mild stress urinary incontinence. Like one industry-supported study cited an 8-gram reduction in 1-hour pad weight for incontinence sufferers. They also claim it treats chronic, painful skin conditions like lichen sclerosis.
Right. The logic there is that the intense anti-inflammatory properties of the concentrated plasma calm the micro tears and the severe scarring associated with lichen sclerosis, bringing relief to a condition that is, frankly, notoriously difficult to treat.
Wait, I have to push back on this.
Oh, wait.
We are talking about one single shot of your own plasma, and the clinics are claiming it fixes nerve damage, builds new blood vessels, thickens thinning tissue, stops chronic pain, and tightens the bladder enough to stop leaks.
It sounds like a lot when you list it out like that.
It sounds like a magical panacea. When a single treatment claims to fix 5 completely different physiological systems, it starts to sound incredibly suspicious to me.
Well, that skepticism is well-founded, and it leads us directly into the critical medical perspective found in our sources. Because when you hold these glossy clinic promises up against independent, peer-reviewed medical journals, the narrative shifts dramatically.
Yeah, the PMC Journal article in our stacks serves as a massive reality check. It warns that we're currently experiencing a rising tide of cosmetic gynecology, and in this highly lucrative gold rush, providers are frequently making sweeping, misleading claims.
And one of the most fascinating revelations in that article is the regulatory loophole surrounding the O-shot.
Oh, this part was wild.
Right. The marketing materials often feature the phrase FDA approved very prominently. But the O-shot procedure itself is absolutely not FDA approved for sexual enhancement.
So they are playing a semantics game with the equipment.
They really are. The centrifuge device used to separate the blood is FDA approved for that mechanical function,
Sure.
but the actual practice of taking that plasma and injecting it into the genitals to improve orgasms is considered off-label use.
Off-label. Meaning what exactly?
It means doctors are legally allowed to use an approved tool or drug for an unapproved purpose if they believe it will benefit the patient. But it means the procedure itself hasn't passed the rigorous safety and efficacy trials required for formal approval.
Right. And the medical journal is very clear that the efficacy of the O-shot is highly debatable because there's a severe lack of robust, independent, long-term data.
Exactly.
But beyond just the lack of data, the journal makes a fundamental point about female anatomy. I mean, female sexuality is incredibly complex.
It is arguably one of the most complex intersections in human biology.
Yeah, it's not a simple mechanical gear where you can just add a biological lubricant and suddenly the machine runs perfectly. An orgasm is a highly sensitive interplay of anatomical structure, hormonal balance, emotional connection, and psychological safety.
You can't just isolate a female orgasm down to local tissue mechanics. You just can't.
No, exactly.
And the scientific community also points out a glaring methodological flaw in the data the clinics do provide. The industry-supported studies boast like a 75% to 94% success rate.
Which sounds amazing.
It does. But how are they defining success? There's a massive lack of validated questionnaires to truly measure subjective experiences. You can't put an orgasm on a scale to weigh its intensity,
Right.
Nor can you easily quantify vaginal tightness without incredibly invasive, standardized tools that these clinics simply aren't using.
And that lack of standardization explains the wild discrepancies in the safety warnings, too, because the clinics advertise zero downsides. But the independent medical community warns that any procedure aiming to alter the vaginal caliber or physically thicken the tissue carries an inherent risk.
Yes, a very real risk.
If the collagen remodeling goes overboard, or if the injection causes microscarring, the tissue loses its ability to stretch.
Which can lead to a condition known as new-onset dyspareunia.
So it causes the very pain it claims to fix.
Exactly. By trying to thicken the tissue to prevent pain, an improper injection or just an unpredictable healing response could actually create permanent, painful sex where there wasn't any before. It is a severe risk that is entirely absent from the promotional brochures.
So if the physical mechanism of the O-shot is unproven, off-label, and potentially risky, why are so many women reporting that it works? Because we can't ignore that those high success rates, even if subjective, represent real women feeling real improvement.
Right, and this is where we have to look at the psychological weight of the procedure.
Yeah.
We shouldn't dismiss PRP entirely. It is a proven regenerative tool in orthopedics and dermatology.
Sure.
But its application for female orgasms might be the ultimate beneficiary of the placebo effect and the mind-body connection.
Let's explore that mind-body connection, because dropping 1,500 pounds on a medical procedure is a massive psychological commitment.
It really is. Think about the typical experience of a woman experiencing sexual dysfunction. Historically, female sexual pain or lack of pleasure has been dismissed by traditional medicine.
Yeah, women are often told it's just a normal part of aging or postpartum life. Just deal with it.
Exactly. So suddenly they walk into a clinic where a doctor sits down, listens to their concerns about their orgasms, validates that their pleasure is important, and offers a high-tech, medicalized solution.
The psychological shift that occurs in that moment has got to be profound.
Absolutely profound. Taking proactive, deliberate steps for your own sexual health reduces cortisol. It drastically lowers performance anxiety in the bedroom because the patient feels they have biologically, fixed the issue.
That mental relaxation alone allows the nervous system to shift into a state where arousal is possible.
Exactly. The orgasm becomes easier to achieve, not necessarily because of the plasma in the syringe, but because the psychological roadblocks have been cleared by the ritual of the treatment itself.
That is fascinating. The shot might just be the permission slip the brain needs to finally relax.
Exactly.
But, if the O-shot is operating in this gray area of unvalidated questionnaires and psychological placebos, what happens when we look for treatments in our sources that actually do have hard, measurable data behind them? The O-shot definitely isn't the only option in the cosmetic gynecology landscape.
Oh, no, the landscape is booming.
Yeah.
And the other treatments generally fall into two distinct categories: injectable fillers, and energy-based devices.
Okay, let's look at the fillers. The sources mention brands like Deserial and Nuvia Rose. These are hyaluronic acid fillers, which is the exact same substance people use to plump their lips or smooth out their cheekbones.
Yes, but these are formulated specifically for the molecular structure of the vulvovaginal area. As women go through menopause and estrogen drops, they lose natural collagen, and severe dehydration occurs in that tissue.
Right.
Hyaluronic acid is essentially a moisture magnet. Injecting it temporarily restores hydration and plumps up the labial volume to provide a physical, protective cushion against friction.
The materials also mention something called the G-shot.
Ah, yes. That is where hyaluronic acid filler is injected specifically into the anterior vaginal wall. The goal is to physically amplify and push out that specific area of tissue, increasing the surface area for enhanced friction and stimulation during intercourse. Again, it's a mechanical approach to a complex problem.
Which brings us to the hardware, the energy-based devices. The sources list radiofrequency machines like Thermiva and laser devices like CO2 and erbium.YAG lasers. Wait, if a laser uses intense heat, isn't that essentially burning the delicate vaginal tissue?
I know.
It feels completely counterintuitive when the goal is to heal and rejuvenate.
It sounds alarming, I grant you that, but it's about controlled thermal injury. It operates on the exact same principle as microneedling on your face. The laser fires microscopic beams of heat into the vaginal wall, purposefully creating thousands of tiny controlled thermal wounds.
So you are deliberately damaging the tissue to trick the body into panicking.
Essentially, yes. The body detects these micro-injuries and immediately initiates its natural healing cascade. It rushes blood to the area, clears out the old cells, and forces the local fibroblasts.
There's that word again.
Yeah, forces them to produce a massive wave of new collagen and elastin fibers. Over several months, this naturally thickens and tightens the tissue from the inside out without injecting any foreign substances or plasma.
And this is where that massive stack of clinical data from NICE becomes incredibly important. Because unlike the subjective clinic data for the O-shot, NICE provides hard, independent numbers on transvaginal laser therapy.
They do. NICE evaluated systematic reviews involving hundreds of patients. And crucially, they rely on a validated medical tool, the Female Sexual Function Index, or FSFI.
How does that scale work?
It's a 36-point questionnaire that measures specific, distinct domains. So desire, arousal, lubrication, orgasm, satisfaction, and pain. It provides a standardized way to track improvement. A total score under 26 indicates clinical sexual dysfunction.
Okay, looking at the laser data based on that index, the results are actually compelling. In a case series of 645 patients treated with CO2 lasers, the visual analog score for dyspareunia, that severe pain during sex, dropped from an 8.7 down to a 3.51 after just 1 month.
That is a life-altering improvement.
It really is.
The pooled data across multiple studies showed statistically significant improvements, not just in pain reduction, but in the lubrication and orgasm domains as well. For women suffering from severe urogenital atrophy, particularly those who have gone through menopause or survived breast cancer treatments, these energy devices are showing real, measurable functional benefits validated by independent researchers.
But reading through this specific section of the NICE data, I had a massive realization.
Oh yeah, what's that?
If the root cause of this thinning tissue, the dryness and the pain, is a systemic lack of estrogen due to menopause, wouldn't a standard traditional estrogen cream prescribed by a regular doctor be significantly easier and infinitely cheaper than paying thousands of pounds for microscopic laser burns?
That is the crucial question that often gets buried by the flashy marketing of these new devices. And the NICE overviews actually include a randomized controlled trial that tests exactly that hypothesis.
Oh, perfect.
Yeah, they compared a group of patients receiving the high-tech laser therapy with a group of patients just using a standard topical vaginal estrogen cream at home.
The results of that study are the biggest plot twist in this entire deep dive.
Right. In the comparative study looking at overall patient satisfaction and symptom relief, the patients using the simple traditional estrogen cream reported an 82.8% improvement rating.
And the laser group?
The laser group reported a 71.9% improvement rating.
That's wild. The basic, relatively inexpensive estrogen cream actually outperformed the multi-thousand-pound laser machine in patient satisfaction.
It did. Now, the clinical difference wasn't considered statistically massive enough to declare one definitively superior across all medical scenarios, but it highlights a profound reality about modern healthcare.
Which is?
Sometimes traditional non-invasive medicine is just as effective, if not more so, than the flashy, expensive new procedures.
Wow. I mean, lasers and PRP treatments like the O-shot are undoubtedly fantastic alternatives for women who simply cannot take hormone therapies like breast cancer survivors.
Absolutely.
But this data proves they aren't necessarily the default superior option just because they involve heavy machinery or cost a fortune.
It reinforces that the newest, most expensive tool in the clinic is not always the biological silver bullet it claims to be.
So, what does this all mean? If you are listening to this right now, perhaps driving to work or making dinner, and you have been quietly wondering if you should book one of these treatments to help with your own sexual wellness, what is the ultimate takeaway from this mountain of sources?
The takeaway is that the O-shot leverages some truly fascinating regenerative science. Platelet-rich plasma is a legitimate biological tool that may improve local tissue health, increase blood flow, and potentially heighten physical sensitivity. But it is vital to separate the biological mechanism from the marketing hype.
Right.
It's an off-label procedure lacking robust long-term data, and it is not a guaranteed miracle cure for sexual dysfunction.
Because female orgasms rely on an incredibly complex web of physical anatomy, delicate hormonal balances, emotional safety, and psychological well-being. A single syringe of your own plasma cannot entirely solve that multifaceted equation.
Exactly. The goal here is to empower you to be a well-informed patient. Knowing the difference between peer-reviewed biological facts and clever high-pressure sales tactics changes the dynamic entirely. If you or your partner are considering investing heavily in intimate wellness treatments, you now have the context to sit down with a medical professional and ask the difficult questions.
You can ask to see the clinical evidence versus the clinic promises. You can ask if a validated tool like the FSFI was used to track their success rates. And most importantly, you can ask if a traditional, vastly less expensive therapy like estrogen cream might be a safer, more effective starting point.
It allows you to make decisions based on physiological science and your own specific needs, rather than being swayed by a glossy brochure promising the impossible.
As we wrap up this exploration into the murky waters of cosmetic gynecology, there is one final thought we want to leave you with, heavily inspired by the psychological impact we discussed earlier.
If female sexual satisfaction is so deeply intertwined with our psychological state and our need for validation, could the very act of investing time, money, and intense care into a medical procedure for our own pleasure be the actual catalyst for better sex?
Right. Is it possible that the true breakthrough isn't the growth factors or the lasers, but rather the radical decision to finally take ownership of your sexual wellness? Perhaps the most powerful shift happens the moment you decide your pleasure is a priority worth fighting for, regardless of what is actually in the syringe.
A powerful perspective to consider the next time you encounter an ad promising a quick fix for a complex human experience.
Thanks for joining us on this deep dive. Until next time, stay curious.